Welcome to Gaul Family Chiropractic. I'm Dr. Tony Gaul, and I would like to share some information with you about the adjusting techniques that we use. There are many different techniques. All of them are designed to bring about a certain change in the human body. Sometimes that change is very subtle. Sometimes it's very noticeable and you notice immediately. This is also why we recommend follow-up care, as we can then help gear your body towards the response we're looking for and explain any side effects that you may be having. Common side effects would be muscle soreness. Think of it like you haven't been to the gym in a while and you start doing a bunch of bench press and now your shoulders are sore. Same thing after we adjust you. You may feel a little shift or soreness as your body adapts to what we did and the corrections we're trying to make. Please let us know if something is concerning for you or it's not what you expect. That way we can walk you through what's going on with your body and help you understand that. We really hope that these videos gear you towards what you're looking for with treatment and help you understand how we adjust you and treat you in our office. Activator Care is a mechanical adjustment using a measured impulse with an adjusting tool. This technique also uses leg checks and kinesiology to ensure the adjustment or correction was successful. The patient is often laying face down or seated, depending upon their comfort level and their condition. Fluid motion is a very minimal pressure, fast or slow technique used with the hand and body movement. Typically, there's no noise or cavitation for this technique. Patient positioning is typically laying down or seated where comfortable, depending on the patient's case. This is very good for osteoporosis, acute injuries, and pregnancy care. Flexion Distraction is a slow, gentle stretching and decompression technique in chiropractic of the lumbar spine and pelvis. It gently decompresses the lumbar spine, including the disc, joints, fascia, muscles, and nerves, restoring normal function to remove pressure and interference in the low back. Typically, the patient is prone and very little noise is felt. You will just feel a gentle stretch as we do this technique. Drop table, also known as Thompson technique, is a light chiropractic technique using a table to assist your chiropractor. Your chiropractor will push on your body, causing a quick drop and a sudden stop, which sets the segment they're adjusting into motion. The patient is typically laying face down, very comfortable, and very rarely will you hear or feel a pop or cavitation. The main noise comes only from the table with this technique. Manual chiropractic has many names. You may have heard it as diversified, Gonstead, or Palmer adjusting, based on Palmer College of Chiropractic. These adjustments are quick, measured adjustments to a joint or body region with low depth and force used by your chiropractor's hands. Patient position varies very much by region depending upon how you're being adjusted. Oftentimes, you will hear a cavitation or a popping noise out of the joint. This sound comes from microscopic gas bubbles coming together and leaving the joint as a certain pressure is reached when you're adjusted. Call us today to learn more about how we can help you find pain relief, better health, and a better life. We look forward to hearing from you and answering your questions.